Okay, so we're going to do Lyme and peripheral neuropathy. And I'm Dr. Martin Rutherford. I'm a certified medical, no, I'm not a yeah, functional
Certified.
medicine. Whew, my head was just somewhere else. I'm a certified functional medicine practitioner. This is Dr. Randall Gates.
I'm a board certified chiropractic neurologist.
Okay, and we're going to do Lyme disease and peripheral neuropathy. We have essentially what has evolved into a chronic pain practice, kind of on its own. And one of the things that surprised us is we came out to the fact that we treat a lot of peripheral neuropathy. So it's probably 30–40% of our chronic pain practice, maybe more at certain points in time. So we have a fairly good grasp of peripheral neuropathy. Dr. Gates is primarily authoring a book on it, and I'm pretty much helping him by editing it into English. But other than that, Dr. Gates has done an enormous amount of research on this, and as recently, we're starting to see Lyme patients. And it turns out that the Lyme patients respond pretty well to the types of procedures that we're doing. We do work in an integrated fashion with Lyme patients. We're not medical doctors. Functional medicine is in a lot of circles, it's considered alternative, but it's definitely non-drug, not medicine. Functional neurology is the same, but we do work with a couple of medical doctors who are conversant in this area, and I've worked in this area. And so we're having a chance to observe the results of working with that Lyme patient's peripheral neuropathy, and frankly, the Lyme patient in general, and being able to observe responses to treatment. And so Dr. Gates would like to share his findings with you, because he is the one who is primarily doing all of the treatment and observing these things and putting together these protocols. So I'm going to defer to him at this point.
Okay. And I will take one step back, as I commonly do, and we'll acknowledge Dr. Horowitz. We've recently read his book. He wrote a fantastic book. It was something to the title of "Why Can I Get Better?" Helping Lyme disease and other chronic diseases. Right. That's not the exact title, but if you look up Dr. Horowitz, he's done a fantastic job, and he talks a lot about the things that we have observed and Dr. Rutherford has come against in terms of treating patients with chronic illness. If you have Lyme disease, you're probably acutely aware of the fact that the standard medical approach is, if you have the rash, we treat you in the first 30 days. If we get the antibiotics into you, you're good. If not, then you're probably going to have to live with it the rest of your life. And that's no cut. That is one group of the Infectious Disease Society's opinion on how to go about it. And then there's another Lyme Disease Association that acknowledges that patients with Lyme disease have these chronic infections, and possibly they can get better through certain types of treatment, not only antibiotics, but other aspects of the immune system, detoxifying their bodies, helping to regulate hormones, things of that nature. Again, as you're acutely aware, if you have Lyme disease, you may have other intracellular infections going on, like mycoplasma, babesia, things of that nature that can be deregulating your immune system. But we say all this to say that peripheral neuropathy is one of the common symptoms and syndromes that is associated with Lyme disease, amongst many others, including fatigue and hormonal dysfunction and fevers and chills and so on and so forth. So basically, with peripheral neuropathy in a Lyme disease patient, our goal is to, in essence, rehabilitate the nerves that have been damaged by the Lyme infection, as well as the other aspects of the immune system that have been dysregulated. We do that largely by shocking the nerves back into life. That's a simple way to say it. We use the example of defibrillating a heart. We do the same things to the peripheral nerves, and clinically we've seen some pretty good results in the Lyme disease patient population. I'm sorry if I refer to it as Lymes from time to time. I know it's Lyme, but it's just easy to say that way for us West Coast people. But that is how we approach it, and we've seen some positive results in our Lyme disease patient population too, because, as Dr. Rutherford mentioned, practicing functional medicine, much of our attention is on the gastrointestinal tract, is on nutrients, is on regulating the immune system, and my focus is therefore, if we clear those things up, can we regulate the nervous system better?
In the book that we are referring to, it is a phenomenal book. of course, because we agree with everything it says. So, but he spends the whole first third. This gentleman is Mr. Lyme. He's had a Lyme practice for over 20 years. He's treated thousands and thousands of cases. He spends the first third of the book talking about that antibiotics, you have to get in the first 10 to 30 days. He doesn't say you have to live with it, but he does say that the medical approach for all the various different variations of what can happen with these bacteria and the other bacteria that are within the framework of those bacteria, and you have to use all these antibiotics, and you have to dose differently, and you have to use different dosing and different medications and different antibiotics. So that's the first third of the book. And he basically says, at the end of that, he basically goes, but that doesn't work most of the time unless you get it in the first 10 days. He said, and here's why. And then the rest of the book essentially was what we do, which we didn't know that. When we read it, it was kind of a shock, but this is what Dr. Gates is referring to now. What they're finding is, and again, when I say what we do, we have worked over a period of time to kind of pull the string on, unravel the mystery of chronic disease, and there's no one mystery. It's a I think Dr.
Horowitz?
I always want to call him Abrams. Dr. Horowitz refers to it as multi-infection disease, multiple infectious disease syndrome, I think he calls it. And I call it multiple systems disease, but the bottom line is you don't want a tick and you got the bacteria. But there then become multiple other issues involved with your immune system that need to be handled, that can stop your downward progression and reverse it. So
exactly. And then if we can do that, and then we can rehabilitate your nerves back into life, lots of times our Lyme disease patients feel better in terms of their neuropathy. Neuropathy can be, we're sorry that this loud car keeps rolling by, but basically neuropathy can be pretty common in the Lyme disease patient population. Upwards of a quarter to a third. Some estimates characterize it in that way. And then also Lyme disease can affect the spinal cord and the peripheral nerves. So that's another thing that has to be watched out for anybody practicing neurology diagnosing you. So that is what we have to say about this subject. I don't think we need to go into too much more detail for this little snippet. But if you have any more questions, you can go to powerhealthtalk.com. You can forward them to us there. And you can also forward us questions on our Power Health Facebook page. Thank you for watching.
Okay. See you next time.